I believe Dr. Joe is ready to join us now. Yeah, we've definitely set the mood for this.
We can talk about a lot of fun stuff.
Right.
Absolutely. The call is ready.
The
call is here.
Yay! Hello, Dr. Joe. Welcome.
Hey, good morning.
How are you doing?
Doing great. How are you guys?
Doing very well. We are 98 hours into our run, and so far we've raised $458,000 US for Child's Play.
That is outstanding work.
Thank you, Fred. I'm Serge, and I'm going to have the privilege of getting to chat with you today. And obviously everybody here and everybody watching at home as well. Dr. Joe, could you give us a brief introduction as to your position and what you do?
Sure. So I'm a pediatric intensivist. So I'm a pediatrician who works exclusively in the ICU. I'm at Children's Hospital Colorado, which is just outside of Denver. It's the main children's hospital serving a 7-state region. We're associated with the University of Colorado there. And I am the medical director of Child Life. And that's a rather unique position. In fact, I'm the only one in the world. And that is because of Child's Play. So as the medical director of Child Life, I'm a physician who gets to advocate for and help direct a lot of the services that Child Life provides throughout Children's Hospital Colorado, and also allows us to do quite a bit of innovation and study of some of the interventions that we do.
How long have you been working with Child's Play and in this? I take it you were a doctor before this, and this is a newer role?
It's a brand new thing. It's odd. I didn't think Child's Play was really in the business of minting doctors, but I mean, here we are.
Sweet.
They've really branched out. I mean, there's the games bit,
Sure.
and then there's the doctors, and frankly, I think they're doing a great job. No, I've been working at Children's Hospital for, let's not do the head math, but
Sure.
say 2002. So quite a while. I did my training there. I've been faculty there for over 10 years. And I've been working with Child Life for about 2.5 years. And through my association with Child Life, with Child's Play for about that long.
And what kind of changes have you seen Child's Play make in the environment that you're working in?
It's where do we want to start? The impact Child's Play has had is profound. At the surface level, there's simply the availability of resources. It takes a lot to be able to serve the tens of thousands of children that come through our doors alone, and just thinking about how many hospitals are served nationwide and worldwide by Child's Play, it's remarkable. And there you're just talking about resources like games, like things to keep kids entertained and engaged, distracted from what they're going through, and really leveling the playing field. I mean, there's unfortunately a real fundamental difference between a child of means who gets hospitalized and a child who's disadvantaged who gets hospitalized for the very same thing. They're under different socioeconomic stressors. They have different things to help them through that stress. And Child's Play and everything that they bring to the table really helps to level that playing field, which for the child, their ability to just be a little bit more chill, more engaged, more distracted, to be able to play and be a kid. That is a fundamental difference with what the hospitalized experience means for them. You think about some kid who's just sitting there watching television versus someone who's able to start engaging in all the benefits that play has. It's remarkable. And if they're happier, they're going to be more active, which we know helps their hospitalization and their recovery. They're going to be more likely to be able to interact in a collaborative way with the staff, be willing to take their medicines, be able to do everything that they need to do to get better and go home. So that's the surface level of what Child's Play's contributions is able to do. But getting to a deeper level, Child's Play also has the grant program. We've been taking advantage of that for several years. When we started that, it was, I think, in 2017. We wrote our grant for the first gaming, what we call the gaming technology specialist position. There are now multiples, and they're going by slightly different names nationwide. But this was a role that we wanted to kickstart, but it was weird, frankly. It wasn't something that the hospital had been thinking about. It wasn't something anybody else had really done in a discrete fashion. And that role in particular was to, well, let's take a step back. If I have a 3D printer, which has been donated by Child's Play, it's awesome. There's lots of really cool things we can do with it, and kids love it. And when we turn that on, they start just lining up and daisy chaining through. And some of the things that they decide to create and what we can do with it is remarkable. But 3D printers are finicky. Knowing how to work them, how to do the CAD, how to work with STL files, how to clean out the print head and change out the filament. That's one device. But then we start thinking about all the other things. What does it take to get a VR system, get a nice Oculus S set up on a gaming laptop and keep that not just working, but integrated with the hospital environment? Then you think about, what are the other challenges? I'm something of a geek. Sometimes it shows through.
Us too. It's okay.
Yeah, I think we're all in a safe space here.
Yeah.
So I have a certain level of comfort with this technology, but a lot of people don't.
Sure.
And a ton of people in the hospital don't. And if they don't have that comfort, then there's a little bit of a reluctance to use it clinically, or they might even not know what it means. They might never have put on a headset, to understand what VR can do for the patients. So we needed someone to help bring down all of those barriers to handle the tech aspect, the education aspect, the patient support, and a ton more. And that was the game and technology specialist in our mind. We wrote up that grant and had pilot funding that Child's Play was able to support us with, to give us a little bit of time to prove to the hospital that this is needed, this is useful, that we can make much better use of all of the resources that Child's Play and other charities bring to the table if we could really use them well. And so we've had a GTS now for pushing 2 years, and it has completely changed what we've been able to do within child life within the hospital. It was this boost where not only do we now have the GTS, we've proven its efficacy. We have now rolled that in. It's a standing position supported by the hospital, which thank you.
Nice.
That is a role that other groups have been trying to crack the nut of and have kind of followed what we did. And Eric always gets on me because I get this number wrong, but I think we have 14 different positions which are either written for or funded through Child's Play. I was about to say nationwide, and I think we might be getting close to worldwide, which is really exciting. And it's starting to create a new standard for pediatric hospitals of you need this person in place in order to deliver standard of care within child life. So we are creating a brand new profession.
That's really cool. That's really cool.
And that's remarkable. And in only 2 years, it's just been a blast. Now, I'll keep going, so let me stop.
Sure. Well, I mean, you're here because we want you to keep going. Now, I think a lot of us can imagine, if you're in a bed and you're playing a game, how that would make you feel better. Are there medical advantages, maybe helping with treatment, that the use of games can do?
Oh, yeah. So I could break this into a couple different buckets too. So let's say just with the distraction bit of just being engaged. There's a distinct difference between someone who is passively watching television,
sure,
this is fun, right? Versus someone who is playing a game, who is intellectually engaged with something. I mean, there's problem solving, right? There are challenges that you're being presented with. You're learning about overcoming those challenges, learning about failure, dealing with success. There's a lot that goes into it. You can try on different personas, different identities. And so that's engaging a different part of your brain. There's also obviously the social component of gaming. Instead of being isolated there, this is something that I could play with somebody that's side by side. I could play with somebody at home. I could play with somebody who is rando on the internet, right? But all of this is a different form of socialization and teamwork or competition, all of which are highly, highly valued in traditional sports. And so you're able to do a lot of that same type of engagement electronically. So that's great. Now, talking medically, how do we use that? Well, if I can give someone a game, let's use VR as an example. A lot of these games are designed so that you have to be sitting up. If you try and play with your head up here, you're kind of looking at the sky. It's not so useful.
Sure.
So it naturally encourages you to sit up a little bit straighter in bed. Well, that can help with airway clearance. That can help with lung recruitment. That can help you get down on your oxygen faster. If we're starting to play something that has even more mobility, I think of something like Beat Saber or other games that require you to be standing or moving your body. Now we're talking about rehabilitation. And the faster you can get somebody sitting up, dangling their feet on the edge of the bed, walking around, that translates into them going home sooner. So it's one thing to have a physical therapist come in and say, we need to do this now. It's effective. They're great at their job, but you can only do that when they're there. And you've got a personnel issue. And it's also I'm doing a task now. I am doing what the adult tells me to do.
Sure. The motivation, right?
Motivation. And when you can have some child who is able to naturally do it just because they want to, because the game encourages them to do these normal active behaviors, that is a wonderful thing. And they're doing it on their terms, which is a whole other area of patient empowerment that is really difficult to achieve in other ways. So there's the rehabilitation bit. There's the pain control. So your brain has a limited bandwidth for what it can really process. And if you're sitting in bed unstimulated and you're in pain, you're going to know you're in pain. You're going to focus that you're in pain, and that's going to make it worse. If, on the other hand, you can be distracted, you can be focusing on something else, that automatically starts lowering that pain level. Does it make it go away entirely? No, not usually, but it can make it more manageable. We can use maybe fewer medications. We can have all those downstream effects. So that's good. But that goes even a step further. One of the studies that we've been able to publish and others that we're running are how to use things like gaming, distraction, virtual reality in this case, in place of some of the more traditional ways that we would provide pain control and analgesia.
Sorry, what's the second word
sorry.
you said?
It's Latin for pain control.
Oh.
So what I meant to say.
I didn't mean to throw you off your rhythm there.
No, you're totally good. So what we found is that for certain patient populations, think about the patients with leukemia, for instance. Part of their chemotherapy requires them to come in and get lumbar punctures, which are spinal taps, frequently, sometimes every few weeks. And most of the time for that, even for patients who are teenagers, we would do that under general anesthesia, which means that we're putting you to sleep. You come in, you have to be not eating beforehand, just like any other surgery. And then you come in, we take you out of the picture by putting you to sleep. Now, you're not feeling the pain, you're not feeling the anxiety during that time, which is great. But you're also, your control of the situation is removed, right? And then you have to recover. You have to take those, or run those medicines out. You have to wake up and then get over potentially some of the nausea, some of the headache that could come along with it, and you then go home. That turns into an entire day of not the most fun ever. What we found is that there are a good fraction of these kids who, instead of using general anesthesia, they're able to use VR, which means they can come in, they can eat beforehand, they can go into the experience on their terms. We can do the lumbar puncture. They get to participate. They understand what's happening to them. They can control their level of immersion in the game. And then when the procedure is done, which is actually a pretty short procedure, about 10 minutes, when that's done, they're done. They can take off the headset. They can go home. Much shorter time. It's better for them. It's fewer drugs. They're in control. And it's even better for the facility because, frankly, we can use less hospital resources to do the same job. And we're starting to see that again and again and again. So there's that. There's also the social aspect of this. When you're in the hospital, especially if you're in isolation, so if you have an infection, you are usually not able to leave your room to protect everybody else from you. If you have an immune deficiency, again, think about some of our cancer patients. Well, you're on isolation to protect you from the rest of the world. Either way, you're isolated. And that is really difficult. You've got social disconnection that's going on there. And even if you're not, I would rather be in school, playing with my friends, hanging out, seeing my family, sitting at the dinner table rather than being in a hospital, even if I'm not isolated within the facility. Through things like just standard gaming, getting on a headset with somebody like we are right now and able to just talk as we play and share an experience. Whether we're competing with each other or collaborating, or going into some of these more social VR experiences, either way, we can start to reestablish a lot of that, again, on the patient's terms. So that's like I said, just a hint of
Just the surface.
some of the ways that we can apply this clinically.
I mean, I think a lot of people are already just like, wow, right? You think of it as a game, you think of it as an escape, and you're like, no, I think of this as medicine.
Yeah, it's way more. It's
incredible.
We're trying to get to the point, and actually there are a couple. I think there's one that is officially able to be prescribed.
Seriously, what's that?
Yes, there is a concept here
cool.
called digiceuticals, where there's a huge ramp to go through, because you have to go through the same types of processing that you would with any other medication or medical intervention, but it just had FDA approval that for this indication, and I am blanking on its name right now. I super apologize, but it's something that's easily Googleable. That your doctor would say, I would need you to play this game for this amount of time, and that is something that is, for this effect.
Sure.
Which means that it has been studied, it has been shown to have that effect. That's where we're really heading.
Amazing. Slight distraction. You have a very good dog that just went through the shot there.
The red one or the brown one?
The brown one.
Well, yep, that's Halo.
Halo? Oh my
Indeed.
God. That's amazing. That's absolutely amazing. Here's a very popular question that's come up. What do the kids love right now? What are they playing in your hospital right now?
So I can tell you what they want to play that we can't.
Do they want to be flossing?
They find ways to floss no matter what happens.
Okay.
Yeah, no, the one that we always have requested is, of course, Fortnite.
Yeah.
And because that is a first-person shooter, and because it has some of the social interactions that we have a hard time policing, that's something that we don't provide directly to the patients. I would like to find ways to overcome some of those challenges, but there's a lot that goes into that. In virtual reality, of course, Beat Saber, just like everywhere else, that's one of the top played ones. Job Simulator is another really popular one with a slightly younger age set. We've got Rocket League, which is being played all the time, especially so we have gaming hours that are not just for the kids, but we've got a closed circuit studio that's in the hospital too. And we can have people come in, play together, and then stream that throughout the hospital.
That's so cool. That's so
the
cool.
Sheer chaos of
Is there like a
Rocket
hospital league that
for
people are playing in?
I want to get there. We're not quite to the level of hospital league, but there's definitely that potential.
That is super cool. That's so cool. Yeah, I've got a couple of questions. We threw up a hashtag for people to ask, and the first one I have here is, I'm a childhood trauma survivor, and I'd like to know how you see gaming and tech as playing a role in reintegration and healing of childhood trauma, both physically and emotionally.
That is an outstanding question. First, to the person who asked, yeah, I'm sorry that you went through that, but you're not alone. And I think there are a ton of people who have had similar experiences who have a very hard time coping with that. There's several ways that we can start to address it. One is to prevent that from happening. The other is to address it after it happens. And depending on what that childhood trauma is, some of those have different interventions. So let me view this through the lens of the hospital, and I think some of it will generalize. As far as what do we do about things after the trauma has occurred, you're getting into a lot of the psychiatric literature, and I'm a pediatric intensivist, so it's not my strength.
Sure.
But I'll tell you where I do see some of the psychiatric field using some of these interventions. One of them is through the ability for instance, virtual reality to build empathy. You can, if I can put you out on the edge of a plank and make butterflies in your stomach because you're afraid you're going to fall, I can induce other feelings as well. I can induce anxiety. I could also induce comfort. I can induce inclusiveness. I can induce the feeling of social exclusion. And depending on what you need in order to address whatever that trauma is, building a proper VR experience really seems to be a low risk, easy to replicate tool that we are already starting to use and are seeing success with. There's a great one that is dealing with, again, the building of empathy and understanding how, try to figure out how to phrase this properly. In the simulation, there are 3 roles that a person can play. You can be viewing the situation. The situation is a group of men who are just at a cafe talking with each other and notice somebody over to the side, and there is then harassment that starts to occur within the game. You can be a witness to it. You can be embodied in VR as part of the group, but not necessarily somebody who's engaging. It's in that situation, it's like your friends are starting to misbehave. And then you can be embodied in the person being harassed. And what's fascinating about that is that that can be a useful tool for people at either end of that social dynamic. And you can build empathy in the person who is predisposed to harassment. You can do exposure therapies for someone who is, has been harassed or has been in that type of assault type of situation. Again, these are sensitive situations, and that we're viewing it in a gaming environment does not lessen how serious this is taken. And some of these can be hard. Taking that down a notch, if you want to get over your arachnophobia, there's a really good way of having exposure therapy there too. But also, let's think about this in a positive way, right? How about someone who is, sorry, I'm getting a call coming through. How about somebody who is wanting to understand what it would look like to be viewed in a female body and presenting themselves as female rather than as male? Someone who wants to understand how people would interact with them if they were, if they had burns or were, otherwise disfigured, or how they would get about an environment without the use of an arm. There's all types of ways that you can start to play in a safe space with different identities and different abilities, and then use that to grow to the point of, well, whatever your clinical goal happens to be. Again, I'll talk for forever, but that's I think there's a lot of that when it comes to childhood traumas and overcoming them that can be done.
Absolutely, absolutely. Here's a very good question. What sort of challenges are you facing as a healthcare professional to make these changes? We're starting to see data supporting this. Is it externally? Is it internally? Where are the friction points, and what do you think we can do to overcome this?
Yeah, no, awesome question too. Obviously, there are a lot of friction points. So the largest one is simply people don't understand. They aren't gamers, so they don't understand what that is. They just see people moving their thumbs, and they are dealing with stereotypes of gaming, which is not in any way accurate, but it's out there, right? So we've got that barrier to overcome of understanding that this is not a frivolous activity. This is not just a distracting activity. This is not an activity for kids. This is not an activity just for teenage males. This is something that everyone does, everyone benefits from, and has real meaning. So thing one, that though is actually relatively straightforward to get over, and that's just by making people understand that they're already gamers in many situations. Like, oh, yeah, game, like, let me see your phone. Like, oh, Candy Crush, that's interesting. So I see this level here that has 3 digits to it. So how'd you get there? Why are you doing this? How are you using this? What does this mean to you? And like, oh, solitaire. Okay, great. I mean, there's so many games. Totally. Or just trying to translate physical, just traditional sports games, and understanding the parallels between that and a lot of what is done in a gaming environment.
Is this from doctors or building parents? Bridges. Like who are the people who are resisting?
Sometimes. And with the parents, it's always insightful to get a little pulse check there. And just, well, hey, so what does your kid play? And if they're like, I don't know, some Sega Master, I don't. tells you where they are.
Sure.
They can't
sure.
even name the proper system, much less the game. And so
Right.
they don't understand what the game is, what it means to the child, what anything comes along with it. At the same time, they're like, oh, and they start dropping knowledge on you. You're in a different position, right? Now, that parent who has a lot of knowledge might still have concerns, but it helps you start the dialogue at a different spot. So you're not talking down to someone, or you're not talking over their heads. So there's the parents, but then there's also the staff of the hospital, understanding what it is and how it could be used. Again, that's exposure. Having people like gaming technology specialists is helpful. Having people like me in the hospital is helpful. But it's really just getting out there and having them walk by a room and see a kid in a headset who's going crazy,
Big smile on their
slashing
face.
invisible sweat. And they're like, I've never seen this child sit up before. And they're out there, cutting through boxes. It's great. They ask questions, and then their wheels start spinning. But there are other barriers that we need to overcome. So there is the just data security. If we're going to be doing this online, how do we make sure that we are protecting the electronic medical record and the infrastructure of the facility? There is the patient safety, which is obviously an issue. If I am providing someone a platform and then they are being griefed and harassed, especially in a very aggressive way, that's a bad situation that I don't want to predispose them to. So we need to address that. There are the safety concerns around, well, if I'm putting somebody in a VR headset and they can't see and they fall, okay, that also reflects badly on me. So we need to do that. There's the epidemiologic concerns. So meaning infection control. So if I have somebody who is using a controller or a headset and they have an infection, how do I make sure that I'm not setting somebody else up down the line for contracting that infection or being exposed to that bacteria, whatever it happens to be? And there are actually quite high standards for that within a facility.
I imagine so.
But we're able to do all of this. It just takes work. It takes time. It takes writing policy and thinking things through and making sure that we're all on the level.
I can also see the importance
outside of that, yeah, totally. Outside of that, it's then finding the right content. I mean, medicine moves slow, and for good reasons. Technology does not. The gaming world does not. And so if I go through all the proper work of making sure that game X has been vetted, by the time I get it through, no one's playing it anymore.
Sure.
So I need to be able to stay at the cusp of things so that it's just socially relevant. And it doesn't look like I'm giving the kids my old gaming system for when I was in college.
Here's a Game Boy. You're like, what is this?
Bingo.
I can see the
Game
importance.
Boy's brilliant, but they have their role. But you really want to be on the edge.
Well, this is why you have, and Eric confirmed this, the 14 specialists in these places.
I got the number right.
Yeah, who are up to date and know how to maintain the equipment and make sure that the kids are happy playing this, right? I've got one last question that I think adds nicely to this, which is with post-secondary institutions putting more and more emphasis on the biotech side of life, what do you see the future of this program looking like? You know, what's next? What do you want to see next?
Oh, wow. We are actually working with the biomechanical engineering department at the University of Colorado to do exactly that. What I think comes next is that you start treating the patients not just as the recipients of technology that we bestow onto them, but finding ways of using this to make them makers, to make them programmers, to make them designers, to allow them to create their own worlds in real time. So not only are they then having an experience that allows them to benefit medically from whatever it is that we're trying to do, but they're emerging from this experience better off than they would have been. And that, again, crosses the whole socioeconomic spectrum. And it doesn't take much for a child to go from being to identifying themselves, changing their self-identity. I am a programmer. Okay, they type one line of code, but they are to them, and that sets them off on a different path as school goes forward, right? I think there's that, and then there's also the biointegration. So finding ways of meaningfully integrating a patient's activity, heart rate, you name it, into the system, so that if we need to use this clinically, I need to target a patient. This patient, I want to be really active. This patient, I want to be really calm. We can start to integrate all of that, and it then is reinforcing the activities that we need to be reinforced this gets really complicated, but that we need to have
No,
reinforced
I can see that.
So
yeah, you don't want somebody to be too active if they can't, or we need to raise it a little bit. And even a silly example is like Zombie Runner. You know, a game that encourages you to run. It's like, okay, sprint, 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 there's something after you, and a way to gamify the behavior you want to see out of somebody to help them recover.
Yep. And that's exactly that. And it's gamifying the hospital experience and doing so in a way that's reinforcing the therapeutic and healthy behaviors that we need.
Amazing, absolutely amazing. If people were interested in seeing the good that this has done, I mean, I don't want to tell people, go look up academic studies, but are there good onboarding points for lay people like myself to see just how much good this has done and show their friends, show their parents, show their colleagues?
We're building more as time goes. Child's Play is obviously an outstanding resource. If you're looking to get involved in your own community, the Child Life, most, if not all, pediatric facilities should have child life departments, and you can find those on their websites. Most of them are going to want people to get involved through their association of volunteers because they want to make sure that they know who is, they're bringing in, but they might have different needs within different facilities, and you might line up in a just wonderful way with them. So yeah, don't expect to just walk in like, I'm a gamer, let's play.
Sure.
There's due diligence to be done, but you can find that on most of your local hospitals' websites. And there is also a growing medical community that is using gaming and virtual reality, and you can find those online as well.
Amazing. Dr. Joe, thank you so much, not only for joining us, but for everything you do.
It's mutual.
We're trying to hold it together here. There's a lot of misty eyes. People in chat are talking about tissues and onions. So thank you
But
so
this
much.
is because of the work that you guys are doing. And this is because of the contributions of this community. The impact is profound. We could not be doing a fraction of this without Child's Play and the community that it represents. So thank you. Thank all of you.
All right. Well, thank you for your time, and hopefully we'll talk to you next year.
Absolutely. Look forward to it.
Bye, friend.
Have fun driving the bus.
Oh, my goodness.